Good morning, everybody. It is said that data is a new oil of the 21st century, but somehow it has turned out that it's not very easy to share this new oil between different emergency services. Even it's very crucial, and there might arise different obstacles, for example, technical, operational, or the need to protect personal data, etc., etc. My name is Kaili Tamm. I am the board member of EENA, and in coming 1 hour, you will hear how the problem to share data between emergency services have solved in Italy, in Switzerland, and in Romania. Giacchino, the floor is yours.
Good morning. I will tell you something. I have 2 apologies for my director. The regional director, Walter Occelli, will not be here because he had a sudden problem. So I reiterate his apologies, and I will talk about the early activation protocol. I represent the single emergency number in Piedmont region. I will show you how it works and the result of this experimentation with some numbers. In Italy, of course, we have several emergency numbers, 112, 113, different. We have 2 law enforcement, fire department, EMS, and medical emergency, and of course, as a PSP of first level, we get all the emergency call, and our call takers, once gathered all the data, who, where, what's happening, so the event will be classified. The call takers will decide which will be the most appropriate PSAP of second level. Now, since this year, we have even the Coast Guard covering over our territory, even if we are in Piedmont and not having the sea. As you can see, in our territory, we have 2 operative centers, one based in Turin with a remote station in Aosta Valley, and the second base is in Cuneo, covering all the rest of the region, 7 provinces, and more than 2 million people. The 7 provinces, and as you can see in Piedmont, we start testing the early activation protocol in 2021. At first, only in the province of Cuneo, a little province with a low population. And then after 6 months, we tested in all our region, covering the 4 million population in total. And it's been decided to start testing the early activation protocol for 2 main reasons. The first one is the time factor, because we all know that saving time is the key to a precise and successful rescue. And as you can see with this protocol, we reduced the time needed to activate the fire department. So we were for 420 seconds to 180 seconds. We are saving 240 seconds, and that's during an emergency. We all know that's quite a difference. The second reason that there is a better and improved coordination between technical and medical operative center. So we will have at least even a rationalization of the intervention resources. This is a simplified flow of our arrangement. As you can see, we have the PSP of first level, the single emergency number, the medical emergency, and the fire department. And we communicate them through parallel dispatch and and forcing them to exchange the data of the intervention. So we had a better and improved communication, improving the intervention resources. Before this protocol, no PSP of second level was willing to share the data and synchronize with each other. Now, the operative center of the second level are no more doubling or diverting field resources, and it can be interesting, even saving money. A technical committee decide how to use the early activation protocol. A technical committee formed with fire department and EMS. So as you can see here in this slide, we use and activate the early activation protocol for just 3 precise events that are car accident, sudden illness in not accessible place, and job-related accident. If the caller, and we have some specific questions to dispatch this early activation protocol. So in a case of car accident, we ask if there are people stuck or injured, trapped inside the vehicle. If there is an accident at work, we ask if the patient is stuck, any body part are stuck in any machinery, if it's an industrial area, and if there are toxic or chemical products. And at least sudden illness in not accessible place. And we ask if it's possible to reach the patient and if the door is open. Once our 112 call takers got all the information needed, they will decide to flag and then to flag the high priority and then activate the early activation protocol. This slide shows you how the 112 center, the EMS, the medical emergency, the fire department manage the event together. We have 2 main flows of the event. The most common flow of the event is one, the caller call the single emergency number. We activate our operator will activate the early activation protocol flagged as high priority, and then we'll send the call to the medical emergency. Meanwhile, we sent a minimum set of data and as flagged as high priority to the fire department. So the medical dispatch keep going, and the fire department already got the form, the MSD form flagged as high priority, so they can already send an engine in the place of the emergency. After the medical dispatch is complete, the medical operator will forward the user, the caller in distress, to the firefighter. So we have a cycle complete, and the caller can speak with medical dispatch, the medical operator, and firefighters. Case 2 of this flow. Same start, same base, caller, single emergency number operator, but in case the caller needs medical instruction or there are more than 30 seconds to wait for the firefighter operative center, the caller will not be forwarded, but instead the medical operator will take charge of the call and coordinating and speak with the firefighter, so they can coordinate the event together, managing and synchronizing the resources on the field. 2 different scenarios, but we had at the same result, a faster rescue, a very faster rescue. In about 1 year of testing in all Piedmont, we got 2,390 car accidents flagged as high priority, 248 sudden illnesses in not accessible place, and 29 accidents at work. So the early activation protocol has been used 4,867 times. There are maybe small number for Piedmont or for an entire nation, but this is a test only for a Piedmont region for covering 8 provinces. And we noted that we managed to synchronize better and rationalization and have more effectiveness in our field resources and intervention. So using the early activation protocol, we had end parallel dispatch flagged as high priority. We noted that the length call from PSP of first level to PSP of second level lasts just a bit more of 2 minutes, and that's quite a difference. So we are saving at least 2-3 minutes from the other normal event. Coordinating with 2 operative centers, otherwise there will not be any communication between them. They just meet in the place of the event and coordinating there. Now we can be faster and be precise. With just one call, we can alert 2 operative centers, and the single emergency number will be free to sorting out other demands from the same event to other PSP of second level, law enforcement, for example. In a car accident, once we call the medical emergency and the firefighter, there is a viability problem, and we can alert law enforcement. So the call taker can even filter other demands from the same event, diverting them, and because the event is just under management, and we can forward only the updating news. So we managed to speed up the rescue, and once we had the lack of communication between medical emergency and fire department, now causing delay and misunderstanding often, now we have a well-oiled mechanism, fast and efficient. Thank you. You can reach my regional director and me at those addresses.
Thank you very much. Do you have any questions from the audience? Yes, over here.
Hello, I'm Georgiana Saboranu from 112 Romania. I was wondering, why don't you use this early activation for other types of cases, like a fire with victims or explosions, not only work-related accidents and car crashes?
Thank you for your question. But do you mean always we don't use it? Because I hear you low. I cannot hear you well. Can you repeat, please?
Why don't you use this early activation for other types of events?
This is the experimentation.
Okay.
So a technical committee decided to start using for just these 3 cases, that car accident, job-related accident, and a sudden illness. We start testing it just with a medical emergency and fire department, but indeed we can involve in the future any other PSP or second level, such as law enforcement or even Coast Guard, for some particular peculiar event.
Thank you.
Thank you.
Thank you. And one more question.
Thank you, Gary Machado, Director of EENA. My question also is about how this project came to be, who initiated it? Was it the 112, the medical services, or the fire people? And another question is, do they meet regularly now to update the protocol, to look into expansion of the protocol?
Thank you. This protocol has been started just to force the PSP of second level in medical emergency and fire department to speak each other for a better coordination. Because before the single emergency number, it was harder for them to speak and even sharing data. It's an old school way to think that the operative center had. I got the call, I run. I got the call, I run. If I meet them, we speak each other. Otherwise, who come first lead. with a single emergency number, and we managed to coordinate all the PSP of second level, so we forced them to speak, and now that the flow go through a single emergency number, we can set, okay, first to a medical emergency, so the caller can already start a medical dispatch. But you already know, fire department, what's happening and where. You can send an engine. So it's now it's appreciated by the PSAP of second level. They talk to each other, and indeed we are improving, because this experimentation is just a start. Because I already said, we can do anything with this protocol and with the exchanging data.
So actually, yes, we have time for one more question.
Good morning. I have one question really about sharing data between agencies. We are doing a working group at the moment, and we're looking at, is there any issue around consent? If somebody rings for an ambulance or for the medical service, have they consented that their information is to be shared? Or do you have any insights into the regulations or legislation around sharing data between agencies?
Sorry, maybe it's my problem, but I cannot hear you loud. Can you repeat, please?
Okay. Can you hear me now?
Yes.
Okay. We're starting a working group around sharing of data between agencies. Is there any issue, regulatory-wise or legislation, in relation to consent? If you ring for a medical and you give details, have they consented that that information is to be shared with law enforcement or with fire service? Have you any issue around that area?
Okay, thank you for your question. We did not have any particular issue in sharing the data. Of course, the medical part of the dispatch stays for the EMS, but to the firefighter will be shared only the location and what's happening. The medical part, maybe even for privacy, will stay to the EMS, but the EMS can share the data in about what's happening, so which instrument is more, which engine is more useful to this particular peculiar event. And I hope I answered your questions.
So thank you. Now we can hear experience from Romania, and Liana, floor is yours.
Hello, everybody. I was actually supposed to deliver this presentation with the head of the 112 Romanian unit. Unfortunately, a work event happened and prevented him from being here, so you're left with just me. I'm Liana, I'm a former 112 call taker, and currently I'm working in the Development Policies Office. And part of this presentation will actually be about kind of my job. So. The focus on the presentation will be on data exchange and cooperation, but of course I'm going to start by introducing you to a few Romanian aspects. So ever since the single European number 112 was implemented in Romania, that is 2004, STS was appointed by legislation the administrator of the single national system. This means that from the very beginning, the perspective and the vision was that of a unitary system under a centralized administration, and it contributed greatly to achieving an effective unitary approach with regard to IT&C solutions, operational policies, exchange of data, but we'll talk more about that further on. Other Romanian facts: we've got about 19 million inhabitants, and only in 2022 we had more than 10 million calls. Out of those, around 6 million were real emergency, and here we feel we're on the right path, because when we started, the percentage was way bigger. In terms of model, We use EENA model 3, which means that all calls are answered at the 41 stage 1 PSAPs that are operated by STS. There is one PSAP in each county. Calls are routed county-based, where in the PSAP from the county they were initiated from. And what really happens is that when a call is answered, a case file opens and the call taker carries out the primary interview. They fill in the information about the situation, the location, the callers, the victims, on average in about 60 seconds. Based on this interview, they then select the type of incident from a default list that is implemented in the software and which hints them who should they send the case to. This list is implemented at national level, so wherever the call is received or if it needs transfer to a different PSAP, it's the same. After that, call takers alert the appropriate emergency agencies, and when they answer the call, they carry on the interview with the caller. One of them does. If it's a cooperation event, we will add in the conference more agencies. And this list also tells us who is the first to speak with the caller. And they will gather specific information related to the intervention and what they need to make an efficient intervention, and then they will assign the intervention units and also coordinate the intervention. Dispatch centers also use the same software as 112 does. So what are we working on right now? What we call a legacy system, because it involves a solid client-server application in each county. And since its deployment, it has processed more than 300 million calls, more or less in the same configuration. Of course, other features were added throughout time, like, well, way back cell ID, and then eCall and SMS and HTML5. And then now we have also a mobile app called 112 and Wi-Fi. And although it's actually 18 years old now, it provides some neat features that we, as call takers and dispatchers, really like. Very efficient audio conferencing with rules that not everybody speaks to each other at the same time and the caller is confused. Data alerts, it provides guidelines implemented in the CAD system, research management, and of course, as I mentioned before, the possibility to seamlessly transfer the calls and data from one PSAP to another, even from stage 1 PSAP to stage 1 PSAP, or in neighboring or random counties throughout the country. But also, for instance, all e-calls and SMSs are processed in the Bucharest PSAP, and then the call takers there transfer the calls straight through to the emergency agencies in the respective counties. So yeah, that's about it. We also have in place an overloading support system. Each neighboring counties help each other, and also we have a national abandoned list that anybody in the country can open and call back in case of overloading as well. But, well, it's 2023. It's the hot topic, NG112 system. So what we are trying to do and what we are actually doing is migrating from a distributed architecture, you remember the 41 interconnected CAD systems, to a centralized one, which is hosted in a private cloud with more data centers in different counties for geo-redundancy and also backup centers. There is going to be only one CAD system nationwide for all PSAP and dispatch centers, and this will lead to greater interoperability and a more efficient management of calls. Because we have in plan to escalate calls in case of overload, and there will no longer be that need to, connect to for a different county. It's the same CAD. You can subscribe to the right inbox, and you will access the incoming calls and the case list and every information you need. Yeah, so we also plan to extend accessibility and via PMEA to receive more information from the callers and to better manage and better help them, actually. So in terms of legal aspects, the same legislation that appointed STS as the administrator of the 112 system defines a body that coordinates its activity. It's a national committee that coordinates the activity, and its president is the Minister of Research, Innovation and Digitalization. The VP is the STS CEO, and there are also representatives from the Ministry of Health and Ministry of Interior and our communication regulator. They are all state secretaries level. But there is also a technical secretariat in which each stakeholder has representatives. And of course, it also defines the PSAPs and dispatch centers' general responsibilities and also the liability limitations. There is an article that states that if the regulations are followed, all call takers and operational personnel is exonerated for any responsibility. And of course, this regulation is endorsed by the committee, as you will see. So I'm going to talk about these two main documents, the call processing regulation and the cooperation methodology. So they're complementary to one another and were both elaborated within a task force composed by representatives of all stakeholders involved in emergency call management, STS, emergency response organizations, and other central authorities. They provide guidelines for the entire call-taking process, from answering the call till transferring, and in the case of the cooperation methodology, until intervention, until reaching the place of the emergency. What I'd like to tell you about the methodology is that once written, it doesn't have to be there forever. So as we change technology, we should also update our procedures and our documentation. So the first one was issued, I think, after 1 year since 112 was deployed nationwide. So that would be in 2006, and it has had several updates. We are currently working on the version that entered into force in 2021. And yeah, here is just a print screen from our current CAD to see how the default list of incident is implemented in the system, and the advice as well. So, of course, I'm going to talk about how we came to have this documentation, and I'm talking about these two because I think they are currently the only ones that were elaborated within such task forces. I remember that they apply nationwide to both call takers and dispatchers in terms of call management especially. So it all starts, of course, with a proposal. Any of the stakeholders can initiate it and send it to all involved parties. And then via the committee, we establish a task force with representatives from all the bodies, and there we analyze the proposal. And then it's circulated for internal feedback. At STS, we have work groups with representatives for all 41 PSAPs to really, we have a saying in Romanian, I'll try to adapt it, tear a thread in four. So to really analyze it from all angles, see what the impact would be, is it worth it or not? And then, of course, a draft is issued, and it's submitted for validation to all the parties, and all the parties sign it, and then it's endorsed by the committee, which establishes the data when it enters into force. And of course, what would life be without follow-up? I'm telling you, it's constant follow-up on this documentation because you really need to, especially when you change something, you really need to keep track of the changes and see how it has affected, because sometimes you win some, you lose some without even noticing. What I forgot to tell you here in terms of methodology, because I really wanted to stress this, I think it's an important change it's brought to us. So you remember 112 call takers gather all the data and then alert the agencies, and then they alert the units. Well, with this change in methodology, we are now able to alert immediately the agencies without taking any other information apart from the event type. So in case of critical emergencies, we immediately alert dispatchers, and then they can immediately alert units, even if all they receive at first is a more or less empty case file, because there's only maybe the county or the phone number or whatever comes automatically, like location and ani. And then the call takers can continue the interview while all the other agencies are listening in the call. So either each one fills their own case file, or the call taker does it for them and then just update the other party's case files. So yeah, sorry for going back, but this is really important because it saves some time. We use it for very critical, severe emergency where life is threatened or the potential impact is massive. So, yeah. Sorry. So what did we achieve by having such a system? First and foremost, no surprises. Not to the call taker, not to the dispatchers, not to the caller especially. So regardless where in Romania you end up calling 112, you will be asked more or less the same questions. The call taker will fill in the information in the same fields. The dispatchers will know where to look for information, regardless if it's a cross-county transfer or it's the local PSAP that transferred that call. So basically, the call is always handled in the same manner and in the same way, regardless of the PSAP and DC. And then everybody knows what to do. The responsibilities are clearly established, especially in cooperation terms. So in the methodology, we also have these particular situations. What if the call taker transferred the call to the wrong agency? What happens then? So it establishes who does what in different situations. Also, maybe worth mentioning, these two documents are public. You can find them on STS's website. But spoiler alert, they're in Romanian, so thank God for ChatGPT, right? Of course, working together in drafting these documents, we got to understand each other better because everybody sees their own side. You know, that meme with I'm here and I see a 6 and the other party is there and sees a 9 and who's wrong? Nobody's wrong, yeah? But being able to meet and to really analyze the situations and listen, okay, I know you want to give me the call as fast as possible, but I really need you to ask this beforehand. Yes, but I'm wasting time. There is always a common ground. You just have to be willing to spend the time and to put in the effort. Because ultimately, all that leads to improved interventions and enhanced cooperation. And you can actually, if you listen to calls, you can hear that, at least on our calls, because I told you, dispatchers also speak with the caller, but because they're not being heard by the caller, they can also whisper to the call taker what other questions to ask, depending on the situation. So what I'd like you to take from this presentation is that the whole process is time-consuming, so it needs thorough planning. Everybody in the emergency services is very, very busy, so you should keep a calendar and assign a coordinator, a responsible that will keep track of the deadlines and deal with correspondence. There is, at least in our case, there was a lot of correspondence apart from the meetings, whether they were face-to-face or video calls, but the results are a lot of documentation. So you need somebody to keep track of that. You should also involve all those directly impacted, because sometimes we have an idea about a thing that doesn't match the operational reality. Of course, and maybe give it a test and assess it in different scenarios. A lot of brainstorming is involved. And also, do not over-regulate, do not overthink things. Keep it as simple and as clear as possible. And really analyze if the outcome is one that is positive, or at first it's something that was simple, but then it created messes along the way. And keep in mind that we do everything for the emergency caller, who needs to have an efficient interaction with the entire system, not only with the call taker, not only with the dispatchers, or not only with those who arrive on scene. And since I have a few more minutes left, I think, I hope.
Yes, you have 1 minute.
1 minute? I'll be very quick because I really want to talk about taking this cooperation one step further. And of course, I'm talking about cross-border cooperation. It's no surprise to anybody that we do need to work a bit on this. Of course, I don't know what were your experiences, but it is tenfold the time to process a cross-border call than a local one. So if we process a call in 60 seconds, if it's a cross-border call, it starts from 60 minutes or 180 minutes. So for emergency situations, I think you agree that it's a bit extreme. And I think we should really concentrate our efforts and do something about it. Join PSAP-DIR if you haven't already, please. But not only. It would be great to be able to speak about exchange of data and standardized interfaces and unitary approaches and procedures at European level, so that all the citizens, no matter where they are, get treated the same. No matter where they are, they would know what to expect. And of course, it would be a lot easier for call takers as well, because it's very, apart from being time consuming, it's emotional wrecking to spend 3 hours on a phone call and not knowing if eventually you will be able to reach somebody that can help that person in need. So with this food for thought, I'd like to conclude. Otherwise, I'll have to conclude anyway. Thank you for your time. It was lovely being here. Thank you, EENA, for the opportunity. And
Thank you.
thank you.
And actually, we have some minutes for questions as well, so don't be shy.
That means everything was clear, so I'll take that as positive feedback. Thank you.
Jerome from Luxembourg. Just to mention the international connections between PSAPs, there is a project, an Interreg project from crossing borders, Luxembourg, Germany, French, and Belgium, and we are on a project to do some platform for these interconnections with translation, and also translation for special words. For example, ambulance is nearly the same, but everybody has different abbreviation, and we are on this to do some platform.
Yeah, that's great. It's exactly what I was referring to, because interfaces and symbols and icons vary greatly. And if cooperation is achieved in terms of ground intervention, in terms of before ground intervention, it's more of an idea right now. So thank you. And if you have a link to a website of the project or where we can get more information, it would be great. Thank you.
So, any other questions? So, thank you, Liana.
Thank you very much.